Hey, everybody. Hi, it's Dr. Jay Harness with another episode of Meet the Experts. Hopefully, many of you have seen our other episodes where we talk about food as medicine and decisions in plastic surgery. But today, we're going to be talking about the importance of exercise for all cancer patients. But as we do a series of interviews with Andrea, Leonard, we're going to emphasize on breast cancer down the road. It gives me, and by the way, I've got two pieces of paper here with more initials on them than I can remember all of them. So I'll do my best, but it's a it's a real treat to invite Andrea Leonard. Andrea is a 35-year breast or cancer survivor, 35-year cancer survivor. She's a personal trainer. She was in 2019, this year, the Personal Fitness Professional Trainer of the Year, which I really think is fantastic. And when I look at all these other initials, she I won't repeat the initials, but she's a corrective exercise specialist. She's a performance enhancement specialist. She's been honored and a member of the National Academy of Sports Medicine. She's a certified personal trainer. Now that one I know. Certified personal trainer. She's a member of the American Council on Exercise, and she's also involved and probably a member of the American College of Sports Medicine. I'm throwing all those initials down on my desk. Andrea Leonard, welcome.
And Thank you, Dr. Harness.
And Andrea, importantly, and one of the reasons I'm involved with her and one of the reasons why she's here with us today, Andrea is the founder and president of CETI, which stands for Cancer Exercise Training Institute. Andrea, welcome. Great to have you here.
Thank you. Great to be here.
So tell us about your motivation, the background, and tell us what CETI does.
Absolutely. Well, my motivation and the background, it really began with my mother back in 1995. She was diagnosed, pardon me, for the second time with breast cancer. And at the time, I was in Washington, D.C., training her breast surgeon, Dr. Catherine Alley, and then her husband, Dr. Richard Flax, who was also a breast surgeon. And one day, Dr. Alley and I were talking, and actually my mother had asked me if I would help her in her recovery, because the first time she had a modified radical mastectomy, but it was kind of at the cusp when they were still doing radicals. And so it was very aggressive. There was permanent nerve damage. She became addicted to narcotics, had to spend a summer at Johns Hopkins going through detox. Was never told to move her arm, was never told about lymphedema, so on and so forth. So she said, Andrea, can you help me in my recovery? And at that point in time, I had been a trainer for about 5 years. And I said to Dr. Alley, what do you think about writing a book on exercises for breast cancer survivors? And I remember standing there at the YMCA, and she said, that's a great idea. And we enlisted Dr. Ted Sangaris, Jr., who at the time was the chief of breast surgery at Georgetown. And then, of course, Shauna Willey, who's your colleague, who's now at Georgetown. And we worked for 3 years along with physical therapists, occupational therapists, and my colleague at the time, Amy Halverstadt, to write essential exercises for breast cancer survivors. So that was, and probably still is, the first of its kind book on progressive resistance exercises for breast cancer. So we took people from, immediately after they were released from their doctor to begin exercise, working on range of motion, pendulum swings, wall walks, those types of things, getting mobility in the shoulder joint. And we have a checklist in the book where we would teach people how to assess themselves in their home, merely in front of the mirror, so that they knew when to progress on to the next 2, 3, so on and so forth levels, and getting back to where they were prior to surgery, or in many times better, because so many people never exercised before in their lives. So that was published in 2000, at which time I moved to the West Coast and kind of simultaneously realized that there was a much greater need going beyond just breast cancer to all types of
Right.
cancer. And I actually first started a nonprofit for breast cancer survivors, but in 2004 started the Cancer Exercise Training Institute, realizing that I could not be the only person out there who knew what to do to safely and effectively help with the rehabilitation and recovery process for cancer patients. So I thought, what if I created an army of, so to speak, of professionals like myself who would be rigorously trained to work with cancer patients during treatment and understand the acute and chronic side effects of treatment, post-surgery, and then well into, survivorship. And so I have since trained roughly 10,000 people in 26 countries.
Wow.
And am pleased to say I will be doing a little tour of Asia in November, going to Hong Kong, Shanghai, Taiwan, Singapore, and Malaysia. And it'll be translated into Chinese. So it's really exciting.
Oh, good for you.
Thank you.
Good for you, Andrea. That's really great. We may be getting a little feedback from your speakers, but hopefully not. Well, that's that is an absolutely spectacular story. So the people that you focus on training through your institute, I think you've shared with me that they're personal trainers like yourself, Pilates instructors, yoga instructors. Who are the folks that you're training? And importantly, as we get viewers that watch this,
Uh-huh.
how would they go about finding people that you have trained as an example that really know the nuance of what to do when it
Yeah.
comes to exercise and recovering from any form of cancer?
Absolutely. Well, it's open to any health or allied health professionals. So anyone in the fitness spectrum, it's typically geared towards a higher level of education, whether that be more certifications or a higher degree, as far as college education. But this isn't for the beginner trainer. It's very complex, and they'll be lost with the anatomy and physiology alone. So we start off with pretty high level fitness professionals. Now, also, I've had many PTs, physical therapists, and physiotherapists, occupational therapists, oncology nurses, patient navigators, and even sometimes some naturopathic doctors. However, I don't go out of my way to market it to that population because, particularly for physical therapists, while they may not know anything about the cancer continuum, they know all of the baseline assessment protocol and that type of thing. And so I worry that it may be a little below their skill level. However, many physical therapists have found it extraordinarily beneficial. And, taking out that one little component of assessment, they learn a lot about the entire cancer process. And we go into the most common 26 types of cancer, as well as pediatrics, and then everything about it, from the direction of the surgical incision, the healing process, medical clearance, lymphedema, identification, prevention, management, cancer pain, cancer fatigue, correcting muscle imbalances, and range of motion limitations, and the order in which it all needs to be done, kind of when to take a step forward and when to know to take a step backward, and so on and so forth. So the training is available in an online format. It's also available in both a 1 and a 2-day live workshop. In terms of finding somebody who is a qualified cancer exercise specialist, patients, family members, anybody who's looking to find someone in their area, can go to thecancerspecialist.com, thecancerspecialist.com. That is the website for Cancer Exercise Training Institute. And right at the top, I believe it just says directory. It's kind of funny how you forget when you try and think of your own website, but I think it says international directory. And so they put in their zip code or their postal code, and they can find anybody who's listed in their area. Now, unfortunately, a lot of people choose not to be listed, which is unfortunate. But people can always contact me directly, and we have so much technology now. For example, what you and I are doing right now, you could easily be my patient, my client, and I could be doing an assessment via, a Zoom meeting or Skype. So there are lots of ways that we can reach out and help people, even when there isn't somebody available in their neighborhood. Although that is my ultimate goal, is to train people in every city, state, country, continent. That's my mission in life.
Good for you. That's absolutely awful. Awesome. So,
I hope it's not awful.
no, awesome. No, I said awesome. Hopefully it came across as awesome.
It did.
So, Andrea, I had no idea that you've done 10,000 people already. You have sent me some of your materials and manuals, and I am absolutely blown away by how detailed they are in each important step along the way for people, as you said, with multiple different cancers.
Yeah.
But why don't we talk for a second about the overall importance of exercise, not only during the recovery phase, but also when it comes to long-term survivorship. I know, and you know, in the world of breast cancer, that there's really good data out there that shows that those who exercise regularly are going to do better, not only from a quality of life perspective, but there's some soft and important data on survivorship, overall survivorship.
Yeah, without a doubt.
Why don't you opine, as they say, on that? Okay.
Okay. Well, just real quick, I can kind of picture the charts in my book. During treatment, it can minimize, and you know this, but it can minimize some of the negative treatment side effects.
Right.
One of the things that I find is so important, it can help with sleep. And without proper sleep, their bodies do not heal. So with corticosteroids and stress and everything, oftentimes people complain of insomnia. Another important factor is it can minimize cancer pain, whether that's from the surgery, whether that's from treatment, neuropathy, whatever the case is. Exercise has been shown to minimize pain. And those two things alone, to me, are reasons for everybody to do some degree of exercise during the treatment process. So we have patients that are stronger in mind and body and are able to better handle the treatment. Then when we move into post-surgery, post-treatment, we are correcting range of motion limitations, especially with breast cancer. I always tell people in class, I say, okay, grab onto here and hold as tight as you can. Now, try and move your arm in abduction out to the side, or try and move your arm in flexion or extension. And I explain based on where the incision is from the mastectomy or the axillary node dissection, or if they've had a latissimus reconstruction, how that can affect all planes of motion. So before somebody should begin doing any kind of strength training, and that even includes yoga, because if I'm holding a pose like a warrior one and one arm is down here, I am exacerbating that imbalance by strengthening it isometrically. So I instruct people to regain range of motion, and we have these quantifiable norms that we use in the book. So we can say when you're at 90% of this, then you can start working on strength training. So with breast cancer in particular, and we have hormonal ablation, and the lack of estrogen, we've got a lot of people who are going to be at risk for osteoporosis, which can be made worse by chemotherapy over the long run. We have potential damage to the heart and lungs, higher incidence of diabetes, and then, of course, heart disease and future cancers. So all of these things can be prevented through the proper, I'm going to use the word prescription, of exercise, and the proper combination of cardiovascular training, strength training, flexibility, but then also to know as a fitness professional kind of where we begin and end, and know when to refer to a registered dietitian or nutritionist to work with that person. So our goal is to improve their body composition. And I'm sure you've seen many people gain weight, particularly body fat, when they're on hormonal therapy. And that can be very difficult to lose. So while we may not be able to lose weight on the scale, the goal would be to increase lean muscle mass and then, of course, decrease body fat. And then Go ahead.
And then no, and then balance is an important thing that you're going to be dealing with as well.
Absolutely. And so with balance, you have other issues. So you may have frailty. If somebody does have osteoporosis, if they have peripheral neuropathy in their feet, we need to avoid high impact activities. And while we still want to work with balance, we have to do it in such a way that we make sure that that client or patient is safe. And so I teach people, how to start by sitting in a chair, raising one leg and then the other. And then if they can do that, we have them stand up and we hold onto a countertop. And if that, and then you progress to one leg and then the other, then you could put them on something that's off balance, like a BOSU balance trainer. If somebody has peripheral neuropathy in their hands, we have to be careful with fine motor skills. So if they're holding a weight or even a band and they have lack of sensation in their fingers, they could drop the weight and hurt themselves. They could let go of a band and that could hurt themselves or the trainer. There are so many different components, but this is kind of my tagline, and I say this now. I had thyroid cancer, but my mom currently now has her third, as you know, breast cancer, which is metastatic this time. And the one thing that I know, whatever type of cancer you have, cancer has the potential to strip you of everything. Your hair, your body parts, your finances, your spouse, your job, your self-esteem, your self-confidence. So as a cancer exercise specialist, if I can give someone back just that tiny bit of control over their body when they feel that they have none, that is a huge accomplishment. It's not about six packs and, bulging muscles. It's about helping someone to feel whole again.
Yep.
It gives me chills because it's so true. And when you see how much impact you have as an instructor on the people who come to you in a class or one-on-one, and when they tell you how important you've been in their lives, that makes it all worthwhile as a fitness professional.
Boy, I sure agree, Andrea. I sure agree. I think it was over 10 years ago, I was a visiting professor in mainland China, and you're heading off to Asia. And this was at a time, it's over 10 years ago. This was at a time when they were doing just primarily modified radical mastectomies on everybody, and they weren't even doing sentinel node at this point, etc. Anyway, the next day I was up making rounds on the floor, and in these giant wards, everybody was in a sling. And I just almost fell over, and I didn't want to be not polite and suggest that was the wrong thing to do.
Right.
Hopefully they have evolved from that, from what I saw when I was out there over a decade or so ago, and I'm sure they probably have. The other thing, when it comes to osteoporosis, far more than chemotherapy, which probably has little effect on osteo, it's really the aromatase inhibitors that are the big culprit as far as bleeding calcium out of the bones and getting people on calcium supplements. And then again, we come full circle now back to the importance of exercise, range of motion, a feeling of wellness, I think. And one of the things that you alluded to is, as you exercise more, you're going to gain more energy, but it's also going to increase your self-esteem about yourself as a survivor.
And actually, I left out energy, so thank you for bringing that up, because that's one of the number one things is the fatigue that affects 76% of cancer patients, and to be able to minimize that.
Yep. Yeah, absolutely. It really stimulates the cellular mitochondria. The more we exercise, the more we stimulate, the more energy we get, et cetera, et cetera.
Right.
Now, when will you be back from Asia? Tell me what your travel schedule is, because we want to get, yeah, exactly. We want to set up a series of these interviews with you, Andrea, so that we go through some of the specific stages. For instance, how should somebody, even though their surgery might be a week down the road or 10 days down the road, what should they do from a physical therapy perspective. We don't want them to run out and join a gym, but
Right.
there are certain things that they can do to get ready for it. Then as they're going to depends, you and I both know it depends on the extent of surgery. What things can they do in sort of the early post-operative phase?
Right.
Then for those patients who are going to be going through chemotherapy, which can be, months in length, what can they do during that phase? And then we'll get into the long-term survivorship. But I want you to be thinking about that's how I want to break the
Yeah.
next one or two interviews down with you, because we want
Absolutely.
people to go away with with practical positive information from our interview with you, and two, as we said earlier, how do I find somebody to work with? You want to comment?
Well, yeah, and another thing I wanted to mention that I left out was the prevention, identification, and management of lymphedema, which
Right.
so many people are not told about, and that is critical. And I believe that it is needless suffering because in most instances it could have been prevented or at least minimized. So we can talk about that as well. And as far as my schedule goes, I don't leave until November 9th. So
Oh,
in the meantime, I'm in the United States doing workshops, Florida, California, and in the DC area. And I think I forgot what it was that you just asked me. I got off on my lymphedema tangent.
well, no, we were just talking about energy. We talked about we want to break our interviews down into
Yes.
practical segments so that people can tune in and watch a 10, 12 minute segment, and at different points along the way saying, wow, this is really important that I
Yeah.
do this now, et cetera, et
Very
cetera.
doable. Well, the other thing that I think would be great from your end of things is if somehow or another we can bridge that gap, which has always been my goal between the medical and the fitness, and get the doctors and the cancer exercise specialists working together. Because what I always suggest when people are in my class is that they offer to work pro bono with any given surgeon or breast cancer doctor, and go in 1 or 2 days, however much per month, and offer to do free assessments on the patient. Because if we could get somebody getting in there working with that patient, when they're diagnosed, so maybe we have 2 weeks, maybe we have 4 weeks before surgery, but to get a baseline measurement of range of motion, a baseline postural analysis, and at that time to be able to give them some very basic things they can do to start preparing themselves for surgery. Then once the surgery is over, to have a follow-up to with the doctor's permission, to start to remeasure the range of motion, to check the postural deviations, and then we can really see what has happened as the result of the surgery or the radiation treatment and scar tissue and adhesions. But that way we've got somebody working with the patient all along and side by side with the doctor, so it's all the care is everybody working together, as opposed to being this segregated community
Right.
of medical versus fitness. I think that's critical.
Yep. One of the things you and I have talked about in the past that I want to do is actually try and get you onto the agenda of our American Society of Breast Surgeons meeting, our annual meeting. We generally have about 1,500 breast surgeons at that meeting, literally from all over the world now.
Yeah.
At my hospital, St. Joe's Hospital in Orange, California, and Northern Inyo Hospital in Bishop, California, there's been a real emphasis on trying to refer patients really early in the process, particularly after diagnosis and before we get into treatment, onto a physical therapist. Even at a critical access hospital like I'm privileged to operate at now, Northern Inyo Hospital in Bishop, believe it or not, one of our physical therapists has gone through a lymphedema training
Right.
to be in that area. And she's also going to be referred to you, my dear, for some additional training. So,
Awesome. Well, and see,
and
that's the thing, and oftentimes physical therapists and personal trainers kind of butt heads because there's this gray area, and I really emphasize to both. Here's where one begins and ends, because at least in the United States, insurance is only going to cover physical therapy for a specific amount of time.
right, right,
We can create a referral system for the physical therapist, the occupational therapist, where they feel confident in referring to somebody who they know is properly trained, then they can create that segue for the patient. So the patient doesn't kind of fall into that moat in the middle, because I think I hear that from so many people that they get done with surgery and treatment, and the lifeline that has been their oncologist, their surgeon, the patient navigator, suddenly that's broken. It's done. I'll see you in 3 months. And they don't know what to do. So we can be that safety net that kind of continues on when their medical care is, over or not as regular.
Yeah, one of my great lines or expressions is we run patients through a gauntlet of things, doctors and treatments, and I mean all of this, and they come out the other side of the gauntlet and they kind of look around and say, "Now what?"
Yeah.
And now really begins the longest part of their journey, which is the whole survivorship.
Right. And you're either going to have the patient who is, oh, woe's me. I've had cancer. My life sucks. My arm is swollen. I have no hair. I don't have breasts. Nobody loves me. Or we empower them. We help them to take control of all that and help them to change that attitude to one of, it's amazing how many people have said to me that they are grateful for having cancer, it's a bit of a stretch, but I understand that sometimes it's an awakening where you realize that you've been taking things for granted. You haven't been living your life to the fullest. You haven't been living your true life that you were here to live. And so I think it goes way beyond just the physical aspects of exercise, but what it can do for someone emotionally as well.
Yep. So one of the things is we're doing this live broadcast. We have people actually watching without any announcement. We're doing this, and I've got a message that I'm looking at here from Peggy Miller. Peggy is asking, can we share a recording of this later? And Peggy, the answer is absolutely yes. I will be reposting this at our Breast Cancer Answers Facebook page. I'll then be linking it onto my personal page. And I will be taking the MP4 video of today's discussion with Andrea and putting that on LinkedIn. Most of our interviews, Andrea and Peggy, for Peggy Miller, end up in the neighborhood of about 3,000 views. And Peggy says, yes, our men need to see this too. You're right. Yeah, absolutely right.
I forgot I had this in my drawer here. So
okay.
This is circa 2000, and you can see here it's the forwards by Peggy Fleming, and we've got Shauna Willey here as well at Georgetown. So even though this book is nearly 20 years old, it's out of print, but you can get it on Amazon. And it's still a great tool for somebody to be able to use, in the absence of an available cancer exercise specialist. And Jay, I will also, people can go to my YouTube channel and I can share all that information with you to make it available, because I have all kinds of videos, and we can do it on Breast Cancer Answers as well. Lymph drainage videos and range of motion videos and correcting muscle imbalances.
So as we wrap this up, Andrea, after you and I get off the air, I'm going to have you email me the links to your pages and whatever.
I'll do that. So will do.
This was being discussed. Peggy has just sent me another message here on MBCC Brothers secret group today. Well, she'll have to tell me in the future what MBCC Brothers is.
Exactly.
And we cannot forget men with breast cancer, and we really can't. Hey, listen, we're going to wrap up this initial interview. Again, this is Andrea Leonard, who is founder and president of Cancer Exercise Training Institute. We'll have the links. We'll also try and get announcements out there about our future sessions with Andrea. These interviews will be saved at our Breast Cancer Answers Facebook page. So, Andrea, great to see you. Congratulations.
You too.
I had no idea that you've actually trained in the neighborhood of 10,000 people. It's absolutely fantastic. So,
been a long time.
You bet. Congratulations. So
Thank
this
you.
is, and I'm Dr. Jay Harness, saying as I say to you, we're here for you, wishing you all the best. Look forward to connecting with you again here at another episode of Meet Our Experts. Take care.